The genetic blueprint of chronic diseases, unlocking the mysteries. Dear Life Takes Guts subscribers, in the complex web of human health, genetics play a pivotal role in determining susceptibility to chronic diseases. While lifestyle factors like diet, exercise, and environment significantly influence health outcomes, the genetic blueprint each person carries can predispose them to various long-term health conditions. Understanding this genetic influence is crucial in the fight against chronic diseases, which are among the leading causes of death and disability worldwide. The genetic underpinning of chronic diseases. Chronic diseases such as heart disease, diabetes, cancer, and autoimmune disorders often have complex etiologies, where multiple genetic and environmental factors interplay. Research has shown that certain genetic variants can increase an individual's risk of developing these conditions. For instance, mutations in certain genes are well known to elevate the risk of breast and ovarian cancers. Similarly, variations in specific genes are linked to autoimmune diseases like rheumatoid arthritis and type 1 diabetes. Genetic predispositions do not guarantee the onset of a disease, but rather indicate a higher probability. This understanding can empower individuals to take proactive measures in mitigating risk factors. For example, someone with a family history of cardiovascular disease might prioritize heart healthy behaviors, knowing their genetic predispositions. Advances in genomic research. Advanced genomic technologies have revolutionized our ability to identify genetic markers associated with chronic diseases. Genome-wide association studies have been instrumental in uncovering thousands of genetic variants linked to various conditions. These large-scale studies analyze the genomes of many individuals to find common genetic denominators that correlate with specific diseases. Furthermore, personalized medicine, which tailors medical treatment to the individual characteristics of each patient, is becoming increasingly feasible. By integrating genetic information with other factors, healthcare providers can develop more effective prevention strategies and treatment plans. For example, pharmacogenomics examines how genes affect a person's response to drugs, allowing for customized medication regimens that minimize side effects and enhance efficacy. Genetic testing, pros and cons. Genetic testing has become more accessible and affordable, enabling individuals to learn about their genetic tendency to chronic diseases. These tests provide insights into ancestry and screen for genetic markers linked to health conditions. However, genetic testing also raises important ethical and psychological considerations. The knowledge of potential health risks can cause anxiety and stress. Moreover, there are concerns about privacy and the potential misuse of genetic information by employers or insurance companies. It's essential for individuals to receive genetic counseling to fully understand the implications of their test results and to make informed decisions. The future of genetics in chronic diseases management. Looking ahead, integrating genetic research into public health strategies holds promise for reducing the burden of chronic diseases. Precision medicine initiatives aim to harness genetic data to predict, prevent, and treat chronic conditions more effectively. Early intervention based on genetic risk factors can lead to better outcomes and more efficient use of healthcare resources. Additionally, ongoing research into gene editing technologies offers the potential to correct genetic mutations that cause chronic diseases. While still in its infancy, this field could transform the way we approach genetic disorders and chronic disease management in the future. Conclusion: the role of genetics in the development of chronic diseases is a rapidly evolving field that bridges the gap between inherited traits and health outcomes. By decoding the genetic factors that contribute to chronic conditions, we can better understand their complexities and develop more targeted interventions. As we continue to unravel the genetic basis of chronic diseases, the promise of personalized medicine becomes increasingly tangible, offering hope for a healthier future. To understand better the role of genetic factors in developing chronic illness, book a free discovery call with me through this link. Here are links to genetic predisposition and testing for chronic illnesses. Thank you for listening.